Welcome to the Real Mama Pod.
I'm your host, Devin.
And I'm your host, Kendra.
We are real moms.
Sharing real experiences. The things people don't tell you.
Hey, Mama, hey.
Hey, Mama, hey.
How you doing, friend?
I'm good. How are you?
I'm wonderful. I could not complain.
Wonderful.
Yes, because we have a guest. But before we get into our guest, if this is your first time listening, I'm your host, Devin.
And I'm your host, Kendra.
Welcome to the Real Mama Pod.
Hey.
Yeah, so tell us about our guest, friend, because you know I'm stoked. I am stoked. We spoke this up. So
we did, and it's crazy how
let's talk about it.
Life happens, how
Right.
God just intervenes. So we have Dr. Chambers here.
Mm-hmm.
She is also known as the period doctor.
Yes.
And how this came about is so wild to me.
Mm-hmm.
So I sit on a nonprofit board here in Atlanta, and I was asked to be a part of this documentary that was happening in Atlanta. It talked about young Black girls and their moms and how they have the conversations around puberty and periods and such. So I was sitting down and waiting for makeup, and I was talking to this beautiful young lady.
Mm-hmm.
And then Dr. Chambers came and sat by me. Now, at this time, I did not know she was the period doctor. So she sat down, super nice. We're talking. We have our parents live in the same city. I'm not going to say where they live, but we're just talking. And I'm like, oh my gosh. I'm like, what do you do? She says, oh, I'm an OBGYN. I said, oh. So when we left, when I left, I got her phone number. I'm like, oh, she's so sweet. And I called Devin. I said, Devin, I know we've been talking about having OBGYN. I met this really nice lady. I think she'd be great for the podcast. So I'm like, let me do some research on her and see who she is. So I sent to Devin. She said, friend, that's the period doctor. I said, I feel like I saw her face somewhere before. That's how we met. Yes. So I was like, oh my gosh. So she absolutely has to be on the podcast. Yes. And she's here.
Yes, absolutely. And I fell in love with her because she did a podcast a while ago with the Love Hour. And I loved that podcast. I would tune in every single week. And the information she provided on there, or you provided on there,
yes.
Oh my gosh, I was obsessed. I listened to that series 3 or 4 times. And so when Kendra was I was like, the period, this is a big deal, friend.
Yeah.
And it's so funny because we have conversations about people we want to interact with. We may not have a vision of who they are, but it's okay, we know we want an OBGYN on there. We know we want a psychologist, a therapist, or whatever the case may be. And God provides these people, right? And it's so crazy how it happens, but it always happens. And I'm just like, dang, we got the period doctor on the Real Mama Pod.
Serious, sitting in the makeup chair, and we just talking, and we're like, girl, where you from?
Yeah.
What school did you go to? Oh, HBCU, love, okay.
Yeah.
Sitting here talking, and lo and behold.
Yeah, so welcome
the whole
to the
period
Real
doctor.
Mama Pod.
Yes!
So happy to have you here, as you can tell.
Thank you for being here.
Yeah, of course.
you.
I'm so excited, and I love y'all's energy. You just make it feel like home.
Oh,
so it just
thank
feels so
you.
comfortable. And I, appreciate the opportunity.
Oh, thank you. That is so sweet.
So we always ask the questions about journey. So we want to know, what was your journey to becoming a doctor?
Oh gosh. So I really think that I first connected with medicine when I believe in high school. So I actually grew up in a family where my dad was a physician. And so he's an OBGYN. And I realized that I was a little bit different when my dad would send me kind of pictures of specimens that he would take out during surgery, like a fibroid or a cyst or something. I'd be like, this is amazing at lunchtime in high school. And my friends would be like, what is wrong with you? I remember one friend was like, that's weird. And I was like, is it? I was like, can you check this out? And that's really cool. And they're like, no. And I was like, okay. And so I went to college. I went to an amazing HBCU, Spelman College.
Okay.
And of course, when you get to college, you really start to, especially if you're so blessed to go to an HBCU, you're able to remove some of those really surface level descriptors. If someone were to describe me in high school, they'd be like, oh, the smart Black cheerleader. They're like, sure. It would be so easy to figure out who I am. But once you get into a place where you're surrounded by smart Black women, you really start to say, what makes me different?
Right.
Who am I, and what makes me me?
Right.
What is my mission? What am I supposed to do? And so I was drawn to really science and math. I love those subjects. And I was drawn to just leadership. And I felt like I was like a thought leader. I wanted to be the person who could really think things through and get to solutions. And so I think around my sophomore year, I was like, I want to be in medicine.
Yeah.
I feel like this is my calling. This is what I want to do. It was only when I got to medical school Then I realized I wanted to be an OBGYN too. So
Wow.
my dad's an OBGYN. My brother, who's 4 years ahead of me, had just started his OBGYN process and kind of declared that was what he wanted to do. And so I was like, I can't do that.
Right.
You know, that's redundant.
Yeah.
We can't take care of men or children. You know, we're really just
Yeah.
in a very small space. Anyway, I ultimately decided I wanted to do obstetrics and gynecology. I think it was after my first delivery. I was like, this is amazing. Like, you're in this beautiful, sacred moment, and you can make a difference.
Yeah.
And I felt so privileged to be in that space. I felt like I will never, ever take this access for granted.
Yeah.
And so that was when I decided. So ultimately, I went to medical school. I went to medical school in Birmingham, Alabama. Great opportunity, great experience. And then did residency. 4 years of residency, which is grueling, you know, deliveries. And then I said, I want to learn more because I'm a crazy person. And so then I did my fellowship, which is in pediatric and adolescent gynecology, which led me to really loving the opportunity to educate people about their periods, especially as they are younger, in the younger years. It made me a better person.
Yeah.
It made me better at speaking to older women. And so that's how I went from, I'm going to do medicine, I'm going to be an OBGYN, I'm going to be a gynecologist that specializes in pediatric and adolescent care. And so it was a long path, a long journey. And, you know, God reveals things to you as needed, you know,
Right.
so you don't always have the whole path, but you get that next step in a moment of clarity, and it kind of guides you where you need to be.
Yeah.
Wow.
You're right where you're supposed to be, girl.
Yeah, and we need more of you in this
Yes.
world.
Yeah.
So definitely love that. Love your journey.
Thank you.
So with being podcasters, we're always learning about different things. Like we thought we knew what motherhood was and knew all things about motherhood, and then we started meeting moms with different journeys and different experiences, things that are happening to them, different diagnoses.
Yes.
Like I learned about endometriosis, which we recently
Yes.
found out Kendra was diagnosed with, PCOS, those type of things. And one common denominator was their periods, right? And having an abnormal period or a normal period and what we thought was normal, but it really wasn't. Even fibroids, like I developed fibroids with my pregnancy, and my mom has fibroids and heavy periods, and I have heavy periods, and just thought that was normal, right? It's just
Right.
something we do. Bad cramping, all of that. So can you describe to us what is a normal period? Because I think we have to start undoing some things so we can get earlier
Absolutely.
diagnosis and stop thinking things are normal when they're not.
So one of my biggest pushes is to get people from confusing the normal and the abnormal, right? And so specifically in the Black community, because we don't talk about periods nearly as much as we should, we are often just referencing the people closest to us. The problem with that is if everybody in your family has fibroids, you are going to think that heavy bleeding is normal.
Right.
If everyone in your family has endometriosis, you're going to think debilitating pain is normal. And so we have to open up these conversations, which is why when I'm asked to do something like this, I love it because I'm like, more people can hear this.
Right.
Because your normal cannot be based on just who you're around.
Right.
There's a difference between common and normal. There's a difference between what my family has and normal. And so that's part of why I love doing the work I do, especially in earlier years, because the earlier we establish normal, the earlier we can identify abnormal, right?
Exactly.
Right.
But the problem is, especially in our society, we don't start paying attention to periods and pain and all these things until we're trying to have a baby. Until
You
it's
said
time for fertility, because, you know, our value as women is so often deeply tied to our ability to procreate.
Right.
Yeah.
That we don't think it's a value sometimes to start looking into these things until we are in the fertility space, which I think is wrong. And so that is why I like to push this conversation early. So the normal for periods actually differs depending on age.
Okay.
And so when we're talking about our adolescent years, the normal cycle range, and so a cycle range is from day one of one period to day one of that second period. We kind of conflate period and cycle, but the cycle is the fullness of it. Your period, your days of bleeding are only part of your menstrual cycle. Does that make sense? And so when we're talking about the full length of the menstrual cycle and its fullness, and not just the period, the normal length is 21 to 45 days for adolescents. And that gets to 21 to 35 days when we're talking about adults.
Right.
And so typically what we're saying is if that day one to day one is longer than 35 days,
Right.
that's abnormal. Now, when we're talking about duration of bleeding,
Right.
longer than 7 days of bleeding is abnormal. And so a lot of folks, especially folks with fibroids, can have
Yes.
prolonged bleeding. Folks with PCOS can skip many periods and then have prolonged bleeding, right? And so those are our signals that something is wrong. And so again, it's the conversation
Right.
outside of our family,
Right.
outside of just our friends,
Right.
with medical professionals that we trust.
Right.
That's how we establish normal. And then we can say,
Yeah.
you know what, this is abnormal, let me get some help.
Yeah. Yeah.
Ooh.
Oh, that was good.
I honestly, growing up, I didn't have these clear definitions of period,
Right.
cycle. I just knew that every 28 days I need to track, blah, blah, blah. And now that I'm older, I'm learning a lot more. And since I've had my son, I've learned a lot more about the female body and how cycles work. And I didn't learn I had endometriosis until I had an ectopic pregnancy, which is why am I just now learning about this after
Exactly.
I'm nearly dead, you know? So I'm glad that you broke that down because
Yeah.
I'm sure there are a lot of moms and just people in general that don't really understand what a cycle is and what a period is and what the difference is between the two.
Absolutely.
Yeah.
Yeah.
Yeah. that was really good. And so we're talking about periods. So I do want to ask this because I have this burning question.
Yeah.
So my ovulation cycle, right? And now that I'm talking, so we started this baby group way before we had even kids. It was called Baby Fever and Moms,
Oh, I
right?
love this.
So if you have baby fever, you can connect with these moms and ask them all the questions. So you can try to prepare as much as possible. You cannot prepare. I don't
Yeah.
care how many questions you ask. But I didn't know that. So every month around the same time, I would have this pain on my left side. I just chalked it up to gas. Like, oh, I'm gassy today, right? And so when we were in a baby group, there was a young lady that told us about ovulation. You know you're ovulating because you feel this pain. I'm like, oh my gosh, I was ovulating all this time. I didn't know. But now I know when I'm ovulating because I know that pain. I know what to look out for. But now that I'm getting older, I feel like it's getting worse. And I feel like I'm on a or my first period, and then I get my second period like 2 weeks later or whatever the case may be. Can you tell us a little bit more about that and ovulation and how that works? Because, again, I'm finding this out as an adult.
Exactly.
And it's
Why-
just like-
why so late?
Right.
Right.
Like, why nobody told me this? And
Right.
it's like, well, maybe people didn't know. Maybe my mom didn't have the words to articulate. Maybe she thought it was
Exactly.
gas too. Who
Right.
knows?
Maybe she don't know.
Okay, and that's a really important part of the
Yeah.
conversation, which is why I like to enter into these conversations with so much grace and
Right.
understanding. We can't just say our parents failed us,
Right, yeah.
Nobody told them.
Yeah, right.
And when you
Right.
think about our ancestors and just the scenarios that they were in, what would be the purpose for them to say, I'm in pain right now?
Right.
Like, who would have necessarily listened to that?
Yeah.
Was the medical system set up to care about that pain?
Right.
Possibly not.
Yeah.
And so it's possible that in a kind of survivor mentality, we just learn to not bring those things up. And so I like to consider the context for our ancestors
Yeah.
and just our mothers and grandmothers and what they may have been going through
Yeah.
and why they may not have paid attention to some of that pain. Because
Right.
Black women in pain, no one
Right.
cared about that.
Yeah.
So why would we bring it up? you know?
Right.
So anywho, ovulation pain, it's so interesting because if you understand the menstrual cycle in its fullness, you then can better understand your body and
Yeah.
kind of say, okay, there's a reason for this discomfort. There's a reason for this pain. Or this pain don't make sense.
Right.
I don't
Yeah.
deserve to feel this way. So let's say we have a 28-day cycle. And
Okay.
again, that's from day one of one period to day
Right.
one of another period. So the first 7 days roughly would be the bleeding days. So that's our period, okay? That means our body said, we are not getting pregnant. We are shedding this lining, this egg, nothing came of it.
Praise
and we're going
God.
to start over. I know. Okay, not really. And so as that lining is shedding, your body's starting again. It is telling the ovary to grow and mature another egg.
Okay.
And so the ovary has all the eggs we'll ever have. We're born with all the eggs we'll ever have. And so when we're in our menstrual cycle and after that period has started, it starts to just say, let's try to release another egg. In order to release an egg, the ovary has to create a follicle or a cyst. It actually grows a kind of pocket around this egg, and then that has to rupture or release. Even the growth of that cyst or that follicle can cause some pain because it's stretching the ovary. So once the egg is released, that's the ovulation piece. But that release can allow for a fluid to leak out or even blood to leak out. And when that happens, it irritates the lining inside of our abdomen, so the peritoneal lining, and that can cause discomfort. And so that is the pain of ovulation. And that happens around like day 14 roughly.
Yeah.
Let's say if we have a perfect 28-day
Yeah.
cycle. And so midway, you're just recovering from the
Yes.
pain. You're like, "Ah!" And so for some people, they don't feel this at all.
Right.
For some people, they rarely feel it. For other people, they feel it every single cycle. And so the literature shows it typically lasts about a few hours to a few minutes, somewhere in that range. But for some people, it can last 1 to 2 days.
That's
The
me.
majority of people can control it with no medication, just rest or over-the-counter medication. But in some rare cases, especially for my adolescents, they're just like,
Yeah.
we're not doing this.
Right.
We can put them on medication that might suppress ovulation, and that would then suppress that pain.
Ah,
Does
okay.
that make sense?
Yeah,
So-
it makes a lot of
Yeah.
sense.
I mean, it's really, ovulation is a normal process.
Right.
The pain of it or discomfort associated with it makes sense without there being
Yeah.
a problem.
Yeah.
But if you are uncomfortable and if it is negatively impacting your life, it is
Right.
worthy of evaluation and
Right.
treatment.
Okay, that was
Yeah,
good.
I didn't start really knowing or understanding ovulation pain until I was much older.
Yeah.
Yeah.
Like, I'm like, what is this?
Well, there's a school of thought that, like, if you're not trying to have a kid, you
Right.
don't need to know about ovulation.
Right. True.
And that's kind of the problem I have. It is the patriarchal mindset that a woman or a person with periods doesn't deserve to understand their bodies because, in my opinion, they are not at a point to have pleasure or sex related to that. And that's the issue. People relate period education and reproductive health with sex. And there's a hypersexualization, especially of Black girls, right? And so in that way, in trying to combat that, what society does, we do it to ourselves.
Right.
By saying, we're not talking about that. We don't talk
Yeah.
about periods.
Yeah.
We're not talking about the vulva.
Yeah.
We're not talking about the appropriate name for the genitalia because they don't need to know that. It's like,
Yeah.
do they not?
Yeah.
If you want someone to protect something
Yeah.
and manage it appropriately, do you not teach them about it?
Yeah.
Yeah.
So keeping this all taboo and all this secrecy, it only just determines that we won't have the language. If something arises, we don't have the language to
Yeah.
communicate it.
Yeah.
And
we've
that's
been
a
more conscious
problem.
about that.
Yeah,
Yeah.
it's a problem.
Yeah.
So,
We
Yeah.
tell our sons that they have a penis.
Yeah.
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 Okay.
You know,
it is what it is.
Yeah.
Of course, like growing up, we say, "Oh, your private parts,"
Yeah, I know.
and it's like, yeah, they are private parts, and this is what they're called.
Right.
Yeah.
That's good.
So we're gonna take a shift in the conversation. So,
I mean, it kind of goes. We're talking about ovulation.
yeah, we
so-
are talking about ovulation, and that's kind of goes. So, I remember going to the doctor earlier this year, and my OB was like, "Are y'all trying to get pregnant?" And at that time, we weren't.
Okay.
And he was like, "So how are you protecting yourself from that?" And I'm like, pull out.
Pull
He
out,
was
pull
like,
out and pray.
pull out and pray method. I said, yeah, that's what we're doing. So I guess our question is, does that really work, or are we risking it all? Like, by pulling it out and praying, like, we are believers, thank you, Jesus. But at the same time, like, does that really, what's the pull out method really work?
So I don't want to say it doesn't work at all. Obviously, by withdrawing before ejaculation occurs, the likelihood of a ton of sperm reaching, the higher parts of the reproductive system into the uterus, fallopian tube, things of that nature, is lower. But lower
Lower.
is not always the best. So I think a pull out and pray is fine in the context of a supportive partnership that would not implode should a child arise. Okay.
Okay, that's fair.
For my patients who are largely adolescents, we're not pulling out
Yeah,
and
well,
praying.
no.
We're not doing, you know what I'm saying? So it's not that these methods should be thrown away
Right.
or, and that's sometimes the nature in which we have conversations, especially the world of social media, the podcast, like it can be so extreme.
Yeah.
Like this is terrible, throw it
Yeah.
away. This
Yeah.
has no value.
Yeah,
No, it has
yeah.
value in certain contexts. And so for a couple where y'all got some situations established, you've decided that raising a child with this person is not, it's appropriate. you
Right.
know, that's fine. So the issue is the fluid that actually comes out before the true, orgasm ejaculation, the pre-cum fluid, can have sperm in it. And so that's why that's insufficient, because the sperm can exist there already. And
Yeah.
so you pull it out, but you not fast enough.
Yeah.
Okay? And so it's really that timing of it. And for especially my teenagers, my adolescents, depending on your partner to get that timing just right,
Yeah.
that's the issue.
Yeah.
Things that increase user error that depend on one
Right.
thing,
Yeah.
that's when the failure rate increases.
Yeah.
So if you look at all birth control, you will see that the most effective birth control is the one that you can't mess up. If your likelihood and your opportunity to mess it up is infrequent, they are the most reliable. So that's going to be our intrauterine devices, our implants, things like that, our injections. But that daily little pill that you can miss, and that's a sober mind. You can wake up at 7 a.m. But I'm focused. You know, people mess up that way. But in a moment of passion, and you got to time it just right, stop. That's where the issue really arises. It is not terrible. You know, many a soul has depended on it. Okay. But if you're like, I definitely don't want to get pregnant, there are way better ways to do that.
Okay.
Oh boy.
Well, you know, you heard it from the
Y'all
doctor
right.
herself.
Lowers. It doesn't prevent, it lowers.
It's lowering.
Yeah, get you some birth control and not them pills. I know one of my friends, actually my sister too, got pregnant on a mini pill. And I told them, I said, don't do that mini pill. Got all wrapped up.
So the mini pill is actually now approved to be an over-the-counter pill that's coming out next year.
Wow.
In 2024, it should be available without prescription, over the counter. And so people are like, oh my gosh, that's amazing. And it is. But with that caution.
Yeah.
So I've recently done some videos on my YouTube and Instagram about the mini pill because it is such a low dose.
Yeah.
It has fewer side effects in a sense.
Yeah.
But its window that you have to take it in is very, very small.
Yeah.
And so that when people say that that's the
yeah.
failure, that's the most likely scenario.
Because life happens.
Life happens.
Life happens. Oh my gosh, of course it does. So it's not a bad thing. It's it lowers.
Yeah.
You know?
Lowers your chances.
But certainly, you know,
you have to be
really
on time.
precise,
Yeah.
profoundly precise. Yeah.
And they weren't. And they got
That's what it is.
Irish twins. But okay, so let's talk about, we have some friends who have daughters. And I don't know if this is to be true or not, but they're noticing like breast tissue for like school age children or developing sooner. Is that a thing? Is that okay? Should we be concerned?
Right.
Like, because I just feel like, and me, I was a late developer. I was flat chested until college. Like I didn't get boobs until college.
Yeah.
And even then it was just flat. But I just feel like now, and some of our friends are seeing like breast tissue.
Yeah.
Like, is that normal? Should they be concerned? Like,
So that's such a good question. So first of all, we kind of have to establish what breast development actually is.
Right, yeah.
And so you will see, let's say, an 8-year-old who might be a little bit on the, chubbier side, a little rounder, softer, and they'll be like, she's got breasts. No, she does not.
Yeah.
It's just that she's got fat deposition in that area.
Okay.
But breast development follows a very specific kind of timeline that was established by a physician last name Tanner. So they call them the Tanner stages.
okay.
And so you can literally see flat chested as in nothing, that's Tanner 1. And so that's typically our prepubertal girls, as in we have no estrogen present in the body. Then you get to that kind of the nipple and areola area developing those little buds where it's kind of painful and it can just be on one side. That's really where breast development starts. And so it actually feels and looks differently. So people would come to me and say, oh my gosh, my 7-year-old is having breast development. I'm like, that's not breast development.
Yeah.
It's just a little bit of, kind of baby fat in a sense.
Okay.
In fact, it's non-discriminatory in some ways of where it goes, right? So that's one piece. But then there's also the fact that puberty is starting a little bit earlier. Since like the 70s when we started having these studies, we've seen changes over time. And it's hard to know exactly what's causing that. There's a lot of like endocrine disrupting chemicals that we expose ourselves to in a variety of ways in our lives. There's a lot of stressors. There's an increase in obesity. And so it's not really explained by all of that. But what we do know is that menstruators that are of African descent actually start this process roughly about 3 to 6 months earlier than their white counterparts.
Wow.
And so we worry about early puberty, not just when it's breast development, but really when we start to get more with like early periods and things of that nature. That would suggest, okay, you're really deep into this puberty, right?
What age would early puberty fall in?
So early puberty would be puberty that starts before the age of 7.
Okay.
And people don't always realize that.
Wow.
They think that, oh my gosh, breast development at 8, oh my God, that's actually not abnormal.
Wow.
So again, it's the definitions.
Yeah.
Starting your period before the age of 9 is early. But come 9, that's still within the range of normal. And so we worry about early puberty because when that estrogen is in the body, it actually causes the bones to stop growing. It closes the growth plate. And so we would have super short folks walking around like 4'2" if they started their period super early. And so what we can do is and this is like super advanced medicine, but we would stop that period and give them growth hormones so that they can grow and hopefully get around 5 feet and then let them resume the period.
Wow.
And so there's a lot of questions and things around early puberty, but the majority of the cases of early puberty that I've personally seen have not actually been early puberty. It's parents not fully understanding the range in which normal puberty can
That's
develop.
good. That's good. That was helpful.
So I'm thinking, like, when did I started my period when I was 10?
I was 13.
Well,
Yeah.
And I thought I
you're
was so
shorter.
late.
You know what I was about to say? Something. I am shorter. I mean, there's that correlation because I had no idea. But yes, and like my breasts, they did come a little early than
Yeah.
some. But,
Okay. I was 12, so I guess I was like on the later side. I
Well,
don't know.
and breast development is really helpful when predicting kind of what puberty is going to look like. And so periods typically start about 2 years after breast development starts. And so breast development is just the signal that your body and your ovaries are producing estrogen. So estrogen causes the breast to grow. It causes there to be like vaginal discharge. So I have parents come in, it's like, she's got vaginal discharge. She shouldn't have vaginal discharge. I do an exam like, she's got breast tissue.
Yeah.
And she can have vaginal discharge. Isn't that crazy?
Okay.
yeah, it sure is.
Yeah.
The body is amazing.
It really
It is. It's amazing.
It is not. It's like a full science project.
Yeah. Yeah.
So while we're on the topic of like menstrual cycles and just you mentioned that you work with adolescents. That's your specialized area. But it's that question of the birds and bees talk. Like, when is it appropriate to have those conversations? And like, we have boys, so it's like, should they know that mommy has a vagina and mommy has breast and mommy's body is different than yours? And like, how do we introduce those conversations to our boys? Because we don't know. So
Yeah.
this is kind of like a 2-part question. Birds and bees talk. When is it appropriate? And then how do we have conversations with our kids about our bodies?
Yeah. So when parents ask me this all the time, which I love, because it means that they actually care enough to be like, what's the right timing? A lot of the times it is asked like with a nervousness, like, ooh, I don't want to bring this up too early. The right answer is it's age appropriate, and kids are mature at different rates,
Yeah.
right? But the same way we guide our kids through a variety of things. So let's just say your kids, when their teeth fall out,
Right.
we guide them through teeth falling out of their head,
Right.
being vacant for a moment, and then other teeth falling through without making it weird,
Right.
right?
Yeah.
Because it's a normal part
Yeah.
of development.
Yeah.
Right? Like,
Yeah.
that's just strange. There's no other bone that's just going to go away. Right? You see what I'm saying? So,
And grow back.
yeah, we can say, it's not that it's like, this is so weird, I can't deal with it. No, we can. It's just that for us, it truly is the sexualization part of it that makes it so odd, right?
Right.
And so if we start talking about it before it's ever related to sex, that makes it easier. And so saying something as simple as you beautifully stated, mommy's body is different.
Yeah.
I don't have a penis. We're different. That's it. They don't need to know they don't need to know all the pieces and all that stuff. They just need to know it's different.
Yeah.
Right?
Yeah.
Just like they need to know that certain parts of their body are different. And that's what I care about, that there's an establishment that this area is different, as in no one should be touching this area,
Yeah.
right? Because we're
Yeah.
worried about safety. Appropriate and inappropriate touching. Those are things we can introduce early. And then as it becomes age appropriate, we can introduce the nuance. Well, daddy can kiss mommy because we're married or whatever, because I say it's okay.
Yeah.
The consent piece, and say, this is when it's okay, this is when it's not. Now, when it comes to the birds and the bees, right?
Yeah.
So we're talking about sex and reproduction. My opinion is that it needs to be brought up and explained at least before they are actually capable of reproducing. So when a child is walking around with a period, and if they did have sex, could have a child, their body has already decided that
Right.
it is time.
Right.
If it is time for them physiologically, they're capable of having a child, they need to know because they need to be able to protect themselves.
Yeah.
And so if my car is capable of going off the road, I need to know where that line is. Someone needs
Yeah.
to talk to me about that.
Yeah.
If I'm driving a car, they don't need to act like accidents don't occur.
Yeah.
Because it's not that I would drive into someone else could drive into me.
Yeah.
Every encounter that could lead to a pregnancy is not something that your child
Yeah.
decides,
Yeah.
right? Which is a terrible thing to consider, but it's a reality. And so my thought is, when it comes to birds and the bees, if we start seeing body development and breast development, talking about puberty and the way I explain it is your body is changing from more of a childlike body
Yeah.
to more of an adult-like body with the ability to reproduce. And then you can go from there, right? Because that's what it is.
Yeah.
And they need to know it.
Yeah.
Yeah.
Yeah, because I know we were just talking about how we didn't have like a real conversation
Yeah.
about the birds and the bees.
Oh,
Yeah.
me
Like
neither.
Yeah.
kind of,
Yeah.
learned about it, and I think my parents
Learn more
were
for our
more
friends.
so like not they weren't comfortable with having the conversation,
Right.
so we just didn't.
But
Yeah.
today's society, with all of the exposure, kids are seeing things so much earlier. I remember a parent got so mad at me because I had to ask her daughter if she was sexually active. It was like a cyst on the ovary, and if it could be a pregnancy. Like, we need to know these things. She's like, you do not ask my daughter that. I said, let me tell you something. She is 12. They're talking about it in her school. And the difference is that I'm asking her to take good care of her. So I must ask her, you can be in the room, but you need to have this conversation before. You were behind the ball. Like, you were behind it. It has already happened. It's swirling around.
Yeah.
And so our denial of it is a complete disservice to our kids.
Yeah.
It doesn't protect them. Being silent doesn't protect them in this matter.
Yeah.
It's better to be ahead of it and say, this is what it is. Come to mommy, come to dad, come to whoever if you have questions.
Yeah.
Yeah.
Right?
Yeah.
Yeah.
Because they're going to talk about it.
They are.
Right.
They are talking
Yeah,
about it.
they are talking about it,
Yeah.
and younger because what they're
Yes.
exposed to. Everything is over sexualized right now.
media.
Social
Yeah.
media. You can try to
Shows
put
and
on a
things they
kid's
watch.
YouTube, and something is still popping up
Something.
on the kid's YouTube.
It's
so
everywhere. It's
there's
literally
no way to get
everywhere.
around it.
Yeah.
Yeah. So I rather our boys, especially, to be prepared and to just respect the woman's body,
Mm-hmm.
right? So they'll. They come in the bathroom. I'm in the bathroom sometimes. And sometimes around my cycle, they are in the bathroom and like, Mommy, what's wrong? You're bleeding. I'm like, Mommy's fine. This is a process that Mommy has to go through every
Right.
single month. And I would like some privacy. So can I please have the bathroom to
And
myself?
that's beautiful.
And if you don't, this is what you're going to see because it's nothing else I can do at this point.
Yeah.
And then my nephew, it's hilarious. He actually brings my sister the sanitary napkin.
Oh,
So it's just like,
those types of conversations, just that scenario will improve how they interact with
Yeah.
future partners,
Yes.
future friends,
because I
future
don't want them to be
employees. Like,
disgusted
colleagues.
because this
Right.
is natural. This is a
That-
part of life. This is
that-
how you got here.
That matters. And I feel like that's how we change future generations.
Yeah.
Right? By parenting our boys
Yeah.
in a way in which they can show up better
Yeah.
as human beings.
Yeah.
If half the world goes through this,
Yeah.
you need to know a little bit something
Yeah.
about it. Like,
Exactly.
a partner who has no clue about periods is not going to be a very good supportive partner
Yeah.
for their menstruating partner
Yeah.
because it's like, you need to know, I
Yeah.
need to tell you everything
Yeah.
about this, right? That is going to be profoundly
Yeah.
impactful for them in the future. I love
I
that you
hope
did
so.
that.
I
Yeah.
hope so because I do want to just get out, please. But
Yeah.
then when you start asking questions, I'm like, okay, I have to
And
tell
your-
them.
and your
Yeah.
I have to
genuine
stop. Yeah, they
questions.
are. They
Yeah.
are. They just want to know. They want to make sure I'm okay. And
you
yeah,
okay?
right. Are you really
His blood
bleeding?
ain't
Do I need to
bad.
call
Yeah.
daddy? Like, what is going on here?
My son
Yeah.
has asked me if I needed a Band-Aid before.
Okay, so
Like,
that
"Mommy, do
is
you need a Band-Aid?"
beautiful.
Like, oh.
Of a different type.
Yes.
He different kind.
Rather large Band-Aid.
It comes packaged like this. Yeah. Oh my god.
So with and I know we're like all over the place, but it's like we got a professional. We got to ask a little bit of everything, okay? But with October being Depression Awareness Month, and postpartum depression being talked about more,
Yes.
not as much as it should be, but more.
Right.
Social media is helping us out with that. Your platforms, just in general, what we're trying to do and how we're trying to shift this conversation. And it's been some recent research that's come out that there's going to be medication
Yes.
for postpartum depression. We want to know your opinion about that from a
Yeah.
professional standpoint.
Yeah. So, I think my bias is that I'm a medical doctor, right? And so my training is in medications and just how the body works. And so I have obviously an openness to medication. So when we think about postpartum depression, and I love that you said postpartum depression because there is a tendency for people like, oh, I had postpartum, which is just not quite good enough. Like to me,
Yeah.
it's like, postpartum is the time period
Yeah.
after we give birth. Postpartum depression is a very specific
Yes.
condition
Yes.
that needs to have a name.
Exactly.
It needs to be called what it is.
Let's call it what it is.
And so, in my opinion, anytime we are bringing forth more options to improve that
Yeah.
for people, I love it.
Okay.
Now, the argument is like, oh, we just need to improve support. We just need to improve access. We need to, which is true.
Yeah.
We need to improve the postpartum, care time period, especially in the United States. But it also, in that same vein, would suggest that someone who does have support has no right to have postpartum depression. And I think that is a direct result of just the ways in which we handle mental health conditions differently,
Yeah.
and the ways in which we kind of say that's not worthy
Yeah.
of treatment, that's not worthy of, you could just work through that.
Right.
And for some people they can, and for
Right.
some people they cannot.
Right.
And for some people that medication is going to be life-saving. And for some people that medication with therapy is going to be exactly what they need. For some people they will never need that medication.
Right.
They need some therapy, they need some time off, they need some
Right.
rest, and they'll get through it.
Right.
But you cannot just erase lived experiences for personal biases, you know? And so I love when options are available,
Yeah.
especially when people are suffering.
Yeah.
People need help. People are afraid to ask for help sometimes because of the taboos around things. And so access to medication, to me, I'm always going to
Yeah.
champion that.
Love that. I love that perspective and how you broke that down. So thank you.
Devin has already kind of prefaced this by saying we're kind of hopping all over.
Which is totally fine.
Yeah, but that was a good question. And in the spirit of October, it's also Breast Cancer Awareness Month. So I know that I had to learn how to examine my breast, and it's not something, again, that was necessarily taught to me. But if there's a mom or any listener out there who wants to know, like, how do I properly examine my breast to just kind of identify potential issues or just to make sure I'm keeping up with my breast health, like,
Yes.
what would you say to that question?
So it's funny because I think over the last 10 to 20 years, there's been increasing debates around, do breast self-exams help, you know? And there's a reality that sometimes when people are doing breast self-exams, especially if you're doing it every second, you're like, oh, I feel something,
Right.
There's an
Yeah,
opportunity
that's me.
where people will be like, I feel something and there's nothing there. But the other reality is that 50% of breast cancers are picked up by the person, right? Because they're doing an exam or because they just noticed something. And so there's definitely a role for you being aware. And so the kind of word that they're using now is like breast self-awareness. So you need to have an awareness of what your breasts typically look like. And that can be standing in front of a mirror and putting your hands on your hips, like doing a little bit of a power pose and
Yeah.
saying, this is what I typically look like.
Yeah.
So that if a change arises, you can see it. Sometimes those changes are subtle. They can be overlying skin changes. It
Right.
can be discoloration of the skin, like stippling of the skin, things
Right.
like that can suggest that there's an underlying issue.
Yeah.
And then there's, of course, the actual feeling where I'm going over my breast tissue in a systematic fashion, like you would mow a lawn, like going over it and feeling
Yeah.
and saying, does something feel abnormal?
Right.
Those are the things I would recommend. The key things that I think people don't always understand is that your breast tissue actually extends kind of up near your collarbone and then under your arm. And so sometimes we have breast cancers that are diagnosed kind of just under the
Yeah.
arm. And people kind of think the breast area has to be what's facing front.
Right.
And it really does extend a little bit more. And so you want to be sure that you're covering that whole area. But I think it's super important to be comfortable with your body,
Yeah.
comfortable touching your body,
Yeah.
and comfortable expressing when things have changed.
Yeah.
That was good.
Yeah.
It
That was
was.
good.
It's-
Wow. Yes. Okay. So, taking another shift. So we have a lot of friends. We are in our mid-30s, right? And a lot of our friends kind of chose like career first and then the husband, but now want to start a family. Some of our friends are struggling with infertility. When is the right time to like seek additional help? Because you know, and you know this as a professional, but they say 6 months to a year can take you to get pregnant and like be okay with that. But like, when should we be like, okay, no, I need a second opinion. I need to do something else. Like, I need to ask more questions. What questions should I ask? Can you guide anyone who may be listening, who may be in that situation right now?
Yeah, so, fertility is this really broad land where it is relevant even outside of a partnership, right? It's relevant outside of marriage. It's relevant out of, I want kids right now. It's, do I ever want kids?
Yes.
And what does that look like? And so my thought process is it's never too early to have the conversation about fertility.
Right.
Because different life events impact your fertility.
Right.
So I've had conversations about fertility with teenagers who have like a cancer diagnosis and they're going to be taking a chemotherapy that's really strong that would potentially harm their ovaries. And so we're saying, what do we need to do? And people say, oh, that's way too early.
Yeah.
It's relevant.
Yeah,
It
is.
has to happen right now. And in this case, it's urgent. And so it depends on the scenario.
Right.
And so if you have a diagnosis like a PCOS or endometriosis, you have to think about those things earlier. What type of surgery am I going to get? Is it going to be a fertility sparing surgery where I'm leaving my uterus in place? What does that look like, right? And so, of course, if you are in a relationship and you have been trying to get pregnant, you're like something is not quite right. The general teaching is if you're over the age of 35, 6 months.
Okay.
You don't need to wait that full year. If you're under the age of 35 without any other kind of period or reproductive health conditions, a year is the time frame that they say you need to wait. Because what it means is you might be, at 6 months freaking out and going to do all these things and you maybe didn't need to do those things, right? And so in an effort to save resources and de-stress and all those things, the idea is to wait to a year. But you can start asking questions day one. Day one of trying, you should be asking these questions to a physician or a healthcare provider that you trust. When should I be worried? Is it different for me? What medications do I need to stop while I'm trying? What medications do I need to start taking to help me improve my likelihood of success? So starting a prenatal vitamin can decrease miscarriages. Things that we need to know about, And so it's never too early to have the conversation. Fertility is a crazy land. It can be profoundly stressful. There's so many things that you can do and things that we also cannot control. And so the earlier the conversation, the better, in my opinion.
Like that perspective.
Honestly, I think that having a conversation around fertility would have helped me with because I had a lot of, I had a miscarriage. I had severe preeclampsia with my son. I learned that I have a microadenoma. I had an ectopic pregnancy, and this year I've learned that I have endometriosis. So I didn't have any symptoms of any of this, like nothing. So all of this was learned because of an experience that I had that led to further research and, this is why or how this happened. So if you're someone listening, you have questions, go ask the questions.
Ask all the questions.
It can prevent a lot of things from happening.
Yeah.
So so I have a question about, this is just your world in the doctor, like the medicine field. There's so much going on in today's society just with medicine, like the abortion laws that came about and just the maternal health of Black women and your role as an OBGYN. Do you feel like it's hard to practice medicine because society is just all over the place? We don't know if we're going left, right, straight, back, north, south, wherever. We don't know. It's exhausting. So just from your lens, like, how is it practicing medicine?
So that's such a good question. I think it is hard to be anyone today.
That's true. That's fact.
Just full disclosure, I think it's hard to parent today. It's hard to be a kid today. It's hard to grow a business. It's hard to be an entrepreneur. There are new barriers and difficulties and obstacles that no one has ever had to face. But specifically in medicine, you highlighted some of the things, in my opinion, the attack on reproductive health and the failures of reproductive justice, they're huge. The fact that there are people using reproductive health education as a political pawn, right? To say, you don't deserve to talk about this until you're 12, until you're 6. Whom? For what reason? That's not based by science. Because if you can start your period at 9, and if we know our Black girls and our Black people with periods are having their periods earlier, that's harming us. That means that this particular group is going to get this education and access later. There's so many attacks on just gender affirming care and care for gender diverse teens. And all of this conversation that makes it hard to just take care of people and to do it with goodness in your heart because you've got policymakers in your exam room, right? It used to be a very sacred space. And I'm not saying that every doctor entered into these spaces with the best intentions. That's an impossibility. But when you do and when you want to, you're not able to. And that is hard. But it doesn't necessarily discourage me greatly. It gives me more fire that says, like, my role is that much more important. Being able to navigate these spaces. And even just practicing in Georgia when the heartbeat bill kind of came through and was actually enacted, and talking to my patients, I said, do you want to have a pregnancy test here or do you want to do it at home? Because if it's positive here, I got to do something about it. It's going to be documented in your chart. And it's just as simple as looking at them and be like, I care way more about you than what's going on. And it's hard because you know what's best for this person. They know what's best for them. And someone else is telling them. So, I think it's particularly challenging right now. I don't think it's going to get easier. But the goal should always be to do what's best for your patient. and to make sure that they feel loved and supported and not judged, and that you never let that change how you view them, how you treat them, how you show up for them. And I joked in a reel, like, I'm gonna go to jail, you know, because I don't want to go to jail. But at the same time, I'm not willing to sacrifice
Right.
the respect and the trust of my patients for some politician somewhere that doesn't care about
Yeah,
it.
that
I
doesn't
imagine
care.
that's a hard
Yeah,
line
that's-
to toggle.
Oh,
It's
it
like-
really
Yeah.
is. You have to be, I mean, there's some strategy there. There's legal advice, you know, there's a
Yeah.
variety of
Yeah.
things. But that's just the climate we're in right now.
Yeah. So speaking of that, the Black mortality rate for expecting moms, for moms who deliver their babies and pass away shortly after, what do you say to that? Like, how do we explain this? How is it
Yeah.
2023 and we are still just dropping like flies? And I take this kind of personally because I know someone personally who passed away, and it really impacted me because I had my son right around the time she passed away, and I'm like, that could have been me,
Oh, yeah.
you know. So it really hits home, and this is a successful woman who was thriving in her career, amazing husband, just amazing person in general, like, and I would have thought she had the best quality of care, right?
Yeah.
Probably at the best hospitals or the best insurance or whatever the case may be, and it still happened to her.
Yeah.
So how do we explain this? How do we get ahead of this? How do we fix this problem?
Right.
Why is it a problem?
Yeah. So, all great questions. And I think there's so many approaches that people are taking, which I think are good. You know, certainly understanding your health as much
Yeah.
is a good thing to do. Making sure you have advocates in the room,
Yeah.
getting doulas and other support people. But it's not like we are failing. Like,
Yeah.
I think it's
Yeah.
super important that Black women are not failing.
Yeah.
We are not showing up enough. You know,
Yeah.
all these things are great, and I think they're good because you don't want to just say, hey, there's something terrible happening and you can do nothing about it.
Yeah.
You know, we want to find actionable steps, and so
Yeah.
we tend to lean into the awareness,
Yeah.
the advocacy, the education land. But it really needs to be an issue that is improved from a system standpoint.
Yeah.
The reality of the situation is that it is a racism and bias thing, right? When you hear about Serena having her pulmonary embolism and walking up to them in her fullness, in her celebrity-ness, and saying, something is wrong. I am short of breath. I need this scan because this has happened to me before. And then saying, no, you just need rest. And silencing her, not taking her seriously.
Yeah.
And all of the money and status and fame,
Yeah.
that's when you know it's real,
Yeah.
right? And it's the it could be me thing that bothers us. And all of my friends, I'm in my mid-30s too, where all of my friends talking about delivering, they are terrified. There's a realness of fear because we know we're 2 to 3 times more likely to die in the childbearing time period when compared to our white counterparts. And so it feels profoundly unfair. Like, we already go through enough.
Yeah.
Why
Right.
this too?
Yeah.
Right? But it is woven into the fabric of our healthcare system. The racism, the bias, all of those things, it's woven into the fabric. And I remember being a resident physician and being like, not on my watch.
Yeah.
Right, I'm gonna show up and do everything I
Yeah.
But I remember a distinct case where even me doing everything I could do did not overcome the bias of the people that encountered
Right.
this patient. And the patient still had a negative outcome. Not mortality,
Yeah.
but still something that was morbidity, something
Yeah.
that could have been avoided. And so I say that to say, the explanation needs to be just plain and clear. It's racism and it's bias. And it is not your duty to fix it. But by being empowered, by making sure that we are aware of our bodies, by making sure that we feel that we have the agency to speak up,
Right.
that at least says, I can do something in
Right.
these scenarios. And it doesn't mean that no one will ever die in childbirth. That's not
Yeah.
a realistic goal. But to make sure that no one ever has an unnecessary preventable death in childbirth, I think is very important. And so it's one of those dark things that you're just like, man, this is the current state, but it doesn't have to be that way. And the important thing is that we never accept it as is. Like, it's
Yeah.
never that we accept it as in, like, we can't do better. We can accept it as a scientific basis of where we are today, but it doesn't mean that this is just good enough. We
Right.
can continue to push for change and improvement. And that's what I do.
Love it.
Thank you for the work that you
Yeah.
do.
Thank you.
We
Thank you.
see you fight.
We
fight.
see you
We
fighting a
stand
good fight.
behind you. So we just have one more question.
Yeah.
And then that's it.
Okay.
But this
It's a
question
personal
is
one.
really
Yeah.
Yeah.
So when I met you, you told me you were engaged.
Yes.
And you are going to be getting married soon.
Yes.
But with all the busy life you have, you
Mhm.
are a successful doctor. You have your own content space where you're educating us about the world of, or your world rather. How did you find time to date? And how did you meet your husband?
So, you know.
Or your, excuse me, your soon-to-be husband.
So dating, I think it was always a bit of a priority for me. You know, I knew I wanted to be married. I knew I wanted to be a mom. And there, you know, there's a lot of language surrounding like, oh, Black women prioritizing their careers. And da, 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 da. First of all, I believe in a God who can do both.
Right.
Okay?
Hello.
And I'm going to operate in that timing.
Yeah.
And so while I was dating throughout college and all those things, there was never the right person. And so it was difficult. It's hard to date people when you're like, oh, I'm available every other weekend
Right.
and only from 9, you know,
Yeah.
you can't call me from 9 to 6. Like I can't answer my phone
Right.
because I'm scrubbed in operating.
Right. Yeah.
You know, it makes it challenging. But it also, and it is intimidating certainly for some guys, you know, they'd be like, well, what do you do? And I would just say, you know,
Yeah.
I work at the hospital.
Yeah.
You know, just I don't need you. Because people start treating you differently. They do.
Yeah.
Oh, a physician. Oh my God. But also, I never hid it. If someone's
Right.
like, what do you do at the hospital? I'm like, I'm a physician. And if that bothers you, my God.
Right.
Self-select, go. Like,
Right.
please, exit
Yeah.
stage left. I don't
Yes.
have time.
I love that.
Because if you are uncomfortable with my career path that I believe my God gave me, you cannot be the person for me. Please
Yes.
save me the time and the
Yes.
trouble. And so I welcomed it. Whenever somebody was like, ooh, that's too much. It is. Please go find less.
Oh,
You know?
yeah. Not less.
But you know, the few that could hang. You know, you have to just use that discernment and pray.
Right.
And I believe very strongly in the power of prayer. And so I was actually about to relocate from finishing my fellowship program in Houston to Atlanta. Got on a little dating app. Was on that dating app for 3 days. Matched with him day one. Connected. He was like, when do you get to Atlanta? And the day after I landed, he took me on a date.
Wow.
And we were dating ever since. So
Love it.
I never really dated in Atlanta as like a
Yeah.
30-year-old, whatever. And yeah, it was just one of those things. I was like, all right, God. And I think it's important that things happen in God's time. And I
Yes.
genuinely believe that. And so I cringe when I hear the rhetoric and the advice that, oh, Black women got to prioritize earlier in life.
Yeah.
When you're in college, you need to try.
Yeah. Yeah.
They need to be ready.
Yeah.
And it needs to be the right person. And so
Right.
there isn't any amount of trying
Yes.
in college that's going to change
Right.
the trajectory of your
Yeah.
life if it is not your destiny.
Yes.
Yeah.
Because
And
marriage
so-
is hard. You got to be prepared for
It
this.
is.
I am so grateful that I am marrying at this time after all of the lessons I've learned, after all of the therapy I've taken,
Yeah.
with all of the things that have occurred in my life as the person that I am right
Right.
now. And I wouldn't change any
Yeah.
of it.
Because you're confident, you know exactly who you are. You're not trying to figure yourself out. And
Yes.
I wouldn't change anything about my life at all. But I met my husband at 19.
Yeah.
So we literally had to grow together.
Yes.
And sometimes you don't like that person.
Oh, yeah.
Right? Sometimes you're still trying to figure out who you are. You're uncomfortable. You're tussling. You're trying to identify, because I'm not the same person that was at
There's so
19, and
much
neither is
growth.
he.
Yes.
Right? But you have that love has to be there.
Absolutely,
Right? You may not
absolutely.
like him in that moment, but that love has to be there. And sometimes people rush in it because of social media. Like,
Yeah. It's the rushing for
couple
me.
goals or whatever the case
Yeah.
may be. And them people that's liking that status don't know what's going on in that household.
You don't know.
And so you have to
no
know
idea.
who you are as a woman first. And my situation with my husband is a little unique because although we were married, he went off to school. I went back to work. So I got to find myself in that short
Yes.
period of time of that 2 years of just being solo and really identifying who Devin is. And I feel like God knew I needed that.
Yes.
And knew he needed that to cover our marriage. And so when we did go through the hard times, because they were rough, okay, we kind of stuck through it because we
Yes,
knew like,
that much
okay,
more.
this is the foundation. And although this may be hard, we got each other's back.
Yeah.
So really
yeah.
just you were able to have your career
Yes.
and your man.
Establish it
And
and be
just says so
comfortable
much.
with
And I never doubted it.
Right.
I never doubted that would be the case because I prayed for it.
Yes.
And God planted that desire
Oh,
in my
yeah.
heart. And I remember being, in the South training, and these little nurses would be like, when you get married, where your husband at? I'm like, oh, don't you go ahead and talk to God about
Yeah.
it. Like if you so
Yeah.
concerned, throw up a
Yeah.
prayer, okay?
Yes.
'Cause
Yeah.
I don't have time.
He's
But
coming.
in the meantime, I'm going to be faithful
Yes.
and focused, and I'm so happy with where I am in my
Yeah.
career. And I'm so happy that I can say, like, I'm genuinely happy
Yeah.
in all the spaces.
Yeah.
I'm just like,
Yeah.
oh,
Yeah.
God is good.
Yes,
He is.
And he's able to do all of
And
it.
he's an on-time God, so he knows exactly what you need when you need it. So
Exactly.
Okay,
There we
exactly.
go.
Well,
Now you about to get married.
right,
Thrive,
I
you and your
know
husband.
exactly.
Thank you. I receive it.
Exactly. Yes. Okay, that was awesome. Thank you for sharing that. Okay, so this episode is also sponsored, friend.
It is.
So it's time for us to talk about Mama Juice. What are we drinking?
So y'all know the trend. We always ask our guests, "What do you like to drink?" And when Dr. Chambers, who's soon to be Dr. What's your
Davidson.
Doctor? Okay, Dr.
Are you changing your name?
I am.
Okay,
All
that's good.
right,
Because we have
yes.
2 Dr. Chambers child. It's too many of us.
It's like it's
fair.
enough. I can
That's
change
good.
mine.
That's good.
But she said she liked sparkling rosé, and I'm like, oh my gosh, that's perfect because our sponsor is a Black-owned wine company, and this is a sparkling rosé that we're drinking.
And it's so good. I
Yeah.
have been sipping.
It's
It's
good,
really good.
but while it is its standard drink, we still called it "That's on Period" because that's on period. Period.
I know.
Yes, that's on period. Inspired by Dr. Chambers.
Thank
Excuse me,
you.
soon to be Dr. Davidson.
Yes.
Davidson.
Yes,
All right.
I love it,
The
and
period
I like that you are changing your last name.
Yeah.
Because I meet a lot of people, and like in the doctor world, or they're already established, right? And they
Yeah.
don't change their last name, so it's pretty cool.
And you
Yeah.
know,
That
I actually thought about that.
Yeah.
And that's what I'm saying. I don't doubt God.
Yeah.
When I even came up with the period doctor, I said, this is an evergreen name.
Right.
It
Yeah.
doesn't matter when my last name
Yeah.
changes, this still works.
Yes.
And so I was like, I'm going to do the period doctor because when I get married,
Yeah.
that's what I want to do.
Right.
Still the
I want-
period doctor.
And I'm still the period doctor. I ain't got to change a thing.
Yes, don't have to change
Might
nothing.
update a logo. But
Yes,
Yeah.
I love that for you. I love that. So our last segment of our show is called Mama's Corner, and so this is our opportunity to connect with our guests further,
Okay.
or our listeners. They may write in and ask us a question, and we'll ask our guests that question. But sometimes we're reflective, and I think this is a great time to be reflective because I had an additional question about our boys.
Yeah.
So we have boy mamas and we have different body parts and stuff like that. And right now, I still walk around freely. Like if I'm taking a shower, I'm taking a shower. I do what I need to do,
Yeah.
and I don't hide myself from them. But when is that like not age appropriate? When should I be covering up? Like I don't know.
So I think it's all about context,
Yeah.
right? And so if you're in a home where you say, hey, we can walk around freely in our home because we're at home, right?
Right.
We're not going to just do
Yeah.
this. So, there's the consent
Yeah.
kind of piece. We're not going to show ourselves to someone else without that consent. But in our home, if you come
Yeah.
into mommy's room and you're in my private space,
Yeah.
I might not have on all my clothes
Right.
in the space, right? That's appropriate.
Okay.
I don't know that there becomes a true age in which it becomes inappropriate as long
Right.
as that relationship is understood
Right.
and that consent remains the same.
Right.
If your child said at some point in their teen years said, I'm actually not comfortable
Yeah.
with that. If you walk into their room,
Yeah. Yeah.
there's spaces and boundaries,
Right.
and that's what needs to be honored,
Gotcha.
right? There is, there's a safe haven of home, and you do as you please in your
Yeah.
home, but acknowledging the humanity
Right.
of our kids today. It's not like once they become 10 or 12, they get to be a human.
Yeah. Yeah,
They're
yeah.
a human whose consent matters, whose
Right.
feelings matter, and it depends on how they respond to that. And so I think you can feel that out and say,
Yeah.
okay, if you come in mommy's room, that's
Yeah.
boundaries.
Yeah.
If you come in mommy's room, you might
That's
see
what
me
you're
unclothed, but I'm not going to walk in your room that way.
Right.
Or I won't walk in front of your friend, something
Yeah.
like
Yeah.
that.
Yeah. Oh Lord,
But
no.
yeah, I don't think it's quite as deep, but there is
Yeah.
that continual just respect.
Yeah.
And just, okay, I respect you
Yeah.
as a person.
Right.
And so if this bothers you,
Yeah.
then I'll be
Stay out
aware
my
of
room.
it. Yeah.
Okay.
Stay out of my room.
I don't like to wear clothes.
Yeah,
And
that's
it's like,
a
at what
restriction.
point should I not be?
I know. Should I put on a bra? Like what?
Oh,
do
Yeah.
I
the
need
bra
to
is
do?
not
please.
negotiable.
Please.
That's not negotiable.
They drop down low to the floor, So yeah. Okay, thank you. Because I'm like, wait, should I? Because now they're asking questions too.
Which
like,
is okay. As
yeah.
long as
So
you're
I'm
good
like,
with fielding them.
poking at that. I'm like, okay, like, should I be like covered or okay? Because I'm a naturally free person, especially in
Yeah.
my space in my home. So
And you get to be you
Yeah.
because you too are you.
yeah, thank you.
Outside of
Thank
motherhood
you.
and wifedom,
Yes,
you're you.
thank you for that.
Exactly. And
So-
we need to be reminded of that.
Yes, you're right,
Right.
friend. Thank you for that confirmation. So if people want to find you, learn more about
Yeah.
you, contact you, whatever, where can they find you? Tell us
So
anything you want to plug too.
Yes.
Because you
Drop
got a lot
it
of
all.
things going
I got a lot
on.
of things going
Drop
on.
it.
So my
Drop it all.
website is pretty straightforward. It's theperiodoctor.com. My email is info@theperiodoctor. You can find me at The Period Doctor on Instagram. and on Twitter, X, whatever
Yeah.
it is now.
All
And
the
just
things.
look out for
Thread.
things in the future. I am writing a book. It's specific to parents, so moms, dads, guardians, anyone who's taking care of a person who can have a period. And so I'm very excited about it. It is to come, so stay tuned. And yeah, I'll be in all those places.
Okay, well, when the book released, we're gonna have you back so we
Absolutely.
can talk about it. And
We're gonna talk. We're gonna talk about the
Yes,
book.
I love that. I love
Yes.
that. So thank you so much. This was
Oh,
great.
thank you for
so much for your
having me.
time.
You
This
guys
was
are
Present.
amazing.
Keep doing the
yes.
good work.
Please,
I shall.
please,
Keep
please.
doing the good work.
Absolutely. Well, until next time, moms. Bye.
Bye.